So I was going to talk today about the vital scan protocol. So that is a protocol intended for PACVS or post-acute COVID-19 vaccination syndrome. And what it includes are several things. Vitamin C, that's the VIT in vital scan, arginine, um, L-serine. There's multiple L's. There's L-arginine, as I mentioned before, L-serine, L-citrulline, L-glutamine, and acetyl-L-carnitine. And the scan, we have creatine monohydrate, acetyl-L-carnitine, and NAC. And there's several things that are doubled over. There is also taurine and nicotinamide mononucleotide, or NMN. So essentially, there are 10 components, 10 different things, and each of these independently has evidence for its usefulness. Actually, the trial for arginine mixed arginine and vitamin C, so we're basing it off that. Um, there was a neutral result when it came to acetyl-L-carnitine. So, we think it could have benefits, especially for increasing beta oxidation, but that one does not have positive clinical trial data. It was more neutral when they actually tested, but yeah, that is just a disclosure. And the other elements, yes, if we get into the protocol itself, L-glutamine. So this has been shown to be depleted in the serum of long COVID patients. So the rationale for several of these components is that you do see them depleted in long COVID, and in a few, they also test if they top up with that supplement, if that improves the symptoms. So there is an ongoing trial for L-glutamine in COVID-19, in post-COVID fatigue. And yes, there is some positive data in the case of acute COVID-19, but not so far in post-COVID. So L-citrulline, this is very good for endothelial function. It is being tested in long COVID at Mount Sinai, and yes, there have been benefits for athletes, for cyclists. It increased their time to fatigue. You do also see not they don't measure citrulline directly, but they see a higher ratio of ornithine over citrulline in long COVID patients, or more severe long COVID patients. So that suggests that citrulline is lower in long COVID patients. So there's not direct evidence on long COVID that is being evaluated at a clinical trial at Mount Sinai. And the next one is L-serine, which is a conditionally essential amino acid, and it is central to the folate cycle, which underpins methylation reactions. It's useful for the synthesis of myelin, sphingolipids, and for normal glial function. This is a metabolite which is observed to be lower in people with long COVID and also associated with symptom severity. So the people who had lower levels of L-serine also tended to be worse off. And this also applied for sarcosine, which is another metabolite. We decided not to include that in the protocol. It is harder to find, and there's not direct clinical evidence for sarcosine. It has been evaluated in schizophrenia, and results tend towards positive, but it's not entirely conclusive. So, L-arginine. This is one of the strongest, the component with probably the strongest evidence base. There was a clinical trial of L-arginine with vitamin C that showed significant drops in fatigue and improvement. So this is one of the better ones. It's good for endothelial function as well. So creatine monohydrate. This, there was a clinical study on this at Novi Sad. That was the group. And yes, it did have a significant impact on body aches, lowering them, and concentration, as well as lowering fatigue. This is in long COVID, so this is very promising data. The trials used 6 grams a day in one, so not a huge dose, but it still seemed to have an effect. That was over, I'm not sure, it doesn't specify. But one of the earlier trials was for 8 weeks. And we have a null finding for acetyl-L-carnitine at 1 gram a day, but that is a lower dose. You do see the long-chain acylcarnines. So this is an intermediate byproduct of fatty acid metabolism, which suggests that it is unable to finish the process. So it's basically an intermediate process, but it doesn't actually produce the ATP. And acetyl-L-carnitine helps it complete this last step. So that is a pretty strong mechanistic rationalization for acetyl-L-carnitine. However, it was tested at 1 gram a day. Again, this is a pretty low dose, and it didn't have an effect on fatigue. N-acetylcysteine. So this is good for replenishing glutathione. This also has been hypothesized to bind with the spike protein. I'm not sure how relevant that is with some of the results on the lack of association between spike protein levels and symptoms. However, it has shown improvement in acute COVID, and it is being tested in post-COVID fatigue. That's not complete yet, but some of the early acute COVID work, as well as mechanism, suggests this could be helpful. And that was N-acetylcysteine. So for taurine, this one actually has positive impact, or I should say it's not in, sorry, I spoke too early about the positive impact. Plasma taurine level inversely correlates with the severity of long COVID. So the people who have lower levels of taurine tend to have worse long COVID. So, it's plausible that by supplementing, by increasing those levels, you get improvement in long COVID. So that's a strong piece of evidence, but there's been no trials on it for long COVID. So I think that one's promising. We covered vitamin C with L-arginine and vitamin C. I don't find this too interesting. It could be, but it's one of those things that lots of people take anyways. Lastly, NMN, or nicotinamide mononucleotide. This one's been tested in long COVID. They did test it with nicotine patches as well as low-dose naltrexone, and they did see an effect in that. It's unclear how that translates to these to taking oral NMN. I should clarify that these were electrophoretic patches, which delivered NAD plus through the skin, taken in addition with low-dose naltrexone, and that showed benefit in the trial. So, it is possible that by taking oral NMN, it is a direct precursor to NAD+, which is central to energy metabolism. It's part of an electron carrier in the parts of the mitochondrial electron transport chain. So that's very plausible. So those are the compounds which comprise the VitalScan for PACVS trial. Just a short introduction on that. We intend to do it as a decentralized clinical trial. So this is to make it possible, as we need to keep our costs very low. This is basically, this isn't a hugely institutional initiative at this point. So, we need to be lean. So we want to do it in a decentralized manner. And so that is, people can buy their kit, which includes the protocol. It includes a blood oxygenation meter, as well as nitric oxide test strips. And basically with that and a smartphone, they can do the entire protocol on their own. And this is entirely over-the-counter supplements. Oh, shoot. So, would be on the safer side. We are looking how this can actually be implemented. It's exciting, but there's still some hoops to go through in order to make it a reality. So that is our intention, is to run this trial, get it approved by an IRB. We're looking in Tegucigalpa at the university there. Anyways, that is the background on the VitalScan for PACVS protocol and the rationale. So thank you for listening.